Uh, Good morning, everyone, and good afternoon for people joining from other parts of the globe. Um, First of all, I would like to welcome you all for this FRC Ophthalmology webinar conducted by the Prep Medico team. I am Dr. Manikandan Kathadvel. I'm the program director for all the FRCS courses of Prep Medico, and I'm a consultant HPB transplant surgeon working at the Whittington Hospital and the Royal Free Hospital, London. And I have with me two of my colleagues who are the leading faculty colleagues for the FRC Ophthalmology program, which we are planning to start in the coming weeks. Dr. Shweta Ravichandran and Dr. Shruti Vaishali Ramesh, both of them working in the NHS Trust in the UK. So the aim of today's meeting is a webinar where we want to share the insights of exam preparation for FRC ophthalmology. We might have a few more participants who will be joining soon, but the whole objectives of this session is for my faculty colleagues to share their journey of how they achieved their the fellowship, sharing with you the details of the various parts of the exam, how to prepare for this exam, the various tips and tricks, various resources, and what we could offer in helping you achieve the fellowship of the Royal College. So I am here just to introduce the Prep Medico team and who we are, and I will give a talk for 5 to 10 minutes, and then I will hand it over to Dr. Shweta and Shruti, who will lead the session from there. The chat box will be open for you to put your questions here, and if you have any doubts, we have at the end, we have a separate Q&A session where you can ask questions to our faculty colleagues, and they can answer all your queries. Or during the middle of the meeting, if you have any doubts, you can raise your hands and we can stop in between and we can speak to you. So first of all, who we are. So Prep Medico is a edutech firm established both in United Kingdom and in India. So the story was maybe 3-4 years back when I moved to UK in 2019, and when I wanted to give my FRCS exam, we went through a lot of hurdles. Eventually, I gave my FRCS exam in 2020, and then we found that there was a big gap for especially the UK non-trainees struggling to give the FRCS exams in the UK. I'm talking about FRCS General Surgery. At that point, me along with few of my colleagues started a small kind of a mentorship program, different from the usual courses for FRCS General Surgery in the UK. And very soon we achieved popularity, and we thought that we should do it in a very formal way to obtain several accreditations. So we started Prep Medico 2.5 years back as an edutech firm, primarily established to deliver FRCS General Surgery courses in the UK for the UK trainees and doctors in the UK as well as overseas. Very soon we became one of the most reputed team providing the FRCS General Surgery mentorship in the UK. And we have close to 40 faculty colleagues delivering the FRCS General Surgery platform. And our courses are completely different from the standard courses, which are very intense, short duration courses. But what we offer is something called as a mentorship program, which is a long course over a period of 3 to 6 months. And we meet now and then, and we guide you and help you preparing for the exam and trying to achieve more one-to-one association between the faculty and the candidate. So this is what we are trying to achieve, and this formula had worked very well for FRCS General Surgery courses for the last 3 years, and we are now delivering our 10th 3-month course. We do 3 courses in a year. And our FRCS General Surgery courses has been officially accredited by the Royal College of Surgeons of Edinburgh, and they endorse our whole course. Following our success formula in FRCS General Surgery, we added two more courses, which is FRCS Vascular Surgery, as well as a Saudi Board Council exam, which is run by the Saudi consultants, exactly following the same model of what we followed in FRCS General Surgery, and both of those courses are also going exceptionally well with excellent candidate satisfaction. With this background, we are stepping into FRCS Ophthalmology Mentorship Program, where again we'll be following same kind of mentorship pathway, and we would offer several modes which a candidate can access for their learning. If you want an one-to-one kind of a training, we can offer. We are planning to bring in a long-term course, like a 3-month course, which you can join and do it. We will be coming up with various resources which you can subscribe for, for your preparation, and we'll be having an generic preparation group where all your queries and things will be sorted out. And so, by and large, the entire programs offered by Prep Medico is more of a candidate-friendly and faculty-friendly programs which we are planning to offer. So this is the background of who we are and what we are planning to do with the FRC Ophthalmology program. And today marks the beginning of this journey of Prep Medico, and we already have one-to-one mentorship in place, and we have 2 faculty at the moment, with the plan of bringing in few more in the next month or month and a half. And we will be ready with our library materials and various essential exam resources in the next coming few weeks, and we will also be rolling out our first kind of a course, primarily aiming at the Viva exams, the part 4 of your FRC ophthalmology exam to start with, but eventually we will be adding on more training programs covering other parts of the FRC ophthalmology exam as well. So this is a brief introduction which I want to give, because I always believe that when someone comes and talks to us, you need to know who we are before you even listen to us. Okay, so we have a very successful story for our FRCS General Surgery candidates, and I can proudly say that we have changed the view of FRCS General Surgery exams, even for people who are non-trainees in the UK and giving the UK FRCS exams. And I'm pretty sure that we can do the same for FRC Ophthalmology pathway as well. So with this brief introduction, I would like to introduce our faculty colleagues, Dr. Shweta and Dr. Shruti. Both of them are my junior colleagues back in India, and they are working at the moment in the UK, and I will leave the stage to them for them to take over. Over to you, Shweta and Shruti.
Thank you, sir, for the lovely introduction. I would like to thank, first of all, Prep Medico and Dr. Maningandan sir for this opportunity to sort of, give our experiences in a wider platform, because we always have people coming to us with the questions that, how do we approach these exams? What does it entail? And what is it worth in the end? So we never had that sort of a proper guidance. It was more of a roundabout way in which we had to collect all the resources, sort of talk to a lot of people, go through, I think it was Telegram, which helped us a lot initially. But now that, to know that such a platform is available to a lot of people who would be benefiting from it is a really, a good start, especially for FRCOphth, because it is kind of a very tough exam. It's not something, I think, like we have FICO, we have FRCS Glasgow and other exams as well, but FRCOphth in itself is a very difficult exam to get through. Even for the trainees who do that in the UK, they face the same difficulties. I have even the UK-based trainees come to me with doubts and queries and how to pass these exams. So as an international candidate, it's going to be a bit more difficult, but never impossible. That's what I try to tell people. It's not impossible to attain. So I hope this course offers people what they're looking for in that aspect. Any other points, Shweta?
I hope I'm unmuted.
Yeah, we can hear you, Shweta. You can continue.
Okay. Like my colleague Shruti rightly said, we personally did not have much guidance. We had to do a lot of research, sometimes go through a few steps twice in order to know what is expected in the exams. Personally, I have kind of followed Shruti here. She was kind of my mentor as well. And I'm really happy and thankful for Prep Medico for giving us this opportunity. My relationship with Dr. Manikandan has been quite a very long one. I was his surgical intern, so I can vouch for him to say that this method will work. That is something I would like to share. Regarding FRCOphth, we'll take you through the steps. What is FRCOphth? So this fellowship is the highest qualification available in the United Kingdom and recognized worldwide. And it is essential to apply for consultant posts in the UK. So there are other degrees which allows one to practice in the UK, get the General Medical Council registration. But for you to become a consultant here in the UK, you need FRCOphth. The trainees here, they have a separate pathway, like who do their residency or the postgraduate training, as we call in India, who do it here. They have a separate pathway, that's the CCT pathway. But for people who are coming from other countries to the UK to start their practice or their training, it becomes a non-training pathway, and you need FRCOphth to eventually become a consultant here. So this consists of 4 parts. 2 written exams, which are MCQs. We'll take you through the pattern and how to prepare for that, and 2 practical examinations, which are mostly OSCE based. The part 2 oral will have 2 other parts where you need to speak, which is quite different from exams we are used to back in India, and I'm sure a lot of other countries. Just a quick thing as to how many attempts are allowed for each exam, because this is something that I have encountered because people find it difficult initially to go through the exams. So you're allowed maximum of 6 attempts. This was changed recently. So any attempt before the August of 2013 is not counted. And for the part 2, which contains the written and the oral components, you have a maximum of 4 attempts. These exams are quite expensive. You need to be aware of, because we cannot afford to kind of give 4 or 6 attempts. If we can, I've just roughly displayed the fee structure that was given by the Royal College in 2024. So the main reason for me to display this particular slide is to reiterate the importance to have a proper guidance to go through these exams, which are not easy, but with the right guidance, you can do it. It is achievable, like my colleague had rightly pointed out earlier. So usually there is an exam calendar that is put out on the Royal College website. I've just copy pasted the thing. Each exam, each part is conducted almost twice a year. Some parts you have more, because in the UK it is twice a year. But now that more candidates are giving the exams, you have options to give it in Greece, Malaysia, and now India and Pakistan as well. Sometimes we have an option with Dubai, but that is not a very constant thing. So keep watching out the space, because they have not made it a standard as to the number of attempts for various sections of the exam. But as far as the written exam is concerned, you have it coming twice a year, and it can be given from any part of the world at the comfort of your home, because it's an online proctored exam. As for the practical ones is what you need to watch out. And most important is you get the maximum number of slots in the UK compared to other places where it's only 20 or 45 at the max. Now over to my colleague, Shruti. She will take you through the parts, how to prepare, and she would add tidbits from our part of our experience.
Thank you, Shweta. As Shweta was introducing about the exams, the number of attempts, I know it's very pricey. So if you have any study budgets or, coming out of your institutes, do use them, because here the trainees do get it out of the study budget. They don't get it out of their pockets. Coming back to the number of attempts, trust me, in the end, it doesn't matter. No one's going to ask you how many times you took the exam. It all matters is you get the degree in the end. So do not get disheartened, because we all had multiple attempts before we finally got the degree. And only when we take the exam did we actually know what it was. So before that, we had no idea. So I hope this will give you as a stepping stone to make sure that you do not have the hardships that we went through. So FRC of part 1, it is an online proctored exam, sort of like how we are sitting here. The examiner is going to have a look at you through your camera via the screen. You're going to have a mobile phone in the corner, which is also going to show the examiner that you're not cheating or like having something else going on. And you're going to have MCQs. So it's going to be 90 questions, 2 sessions. It's going to be morning and in the afternoon. But trust me, like you don't even need the total, like I think it is 2 hours per session. You don't even 2 to 3 hours. You don't need that much time to finish the questions. You'll actually finish it quite early. And 1 hour gap between the first session and the second session. I would suggest utilize it, because more often than not, say that they have an image in the first part of the session with a question of, say, the supraorbital fissure. It's going to come in the second session again, the same image with a different set of questions, with maybe a different approach, maybe from anatomy, maybe from physiology, but it's going to happen. Same, for example, with statistics. If you have a sensitivity specificity question, it might come back in the second session with the same data. So you might feel like, oh, I did not do well in the first session. So don't give up. You might actually get the same stuff back. So try to sort of, revise a bit in between the sessions and get those answers right, because it is a cumulative mark. It's not, you need to pass the first session separately and the second session separately. And the second part of it is, make sure that you have adequate time for preparation. The first question people ask me is, I have only 3 months. Is it enough? If you have already done your residency, you have finished your master's, yes, it's enough. So for people like us coming from India or other countries who are already practicing ophthalmologists, where you have already done your basic science exams, then yes, it's more than enough 3 months. If not, I feel it would be inadequate. If you are in training right now, then you would need more time to prepare, maybe at least 6 months, because multiple revisions is mandatory. Without that, it won't be easy to pass the exam. Proper technique. So at this point, if you're going to start with reading a book from cover to cover, that is not how you're going to pass the exams. Maybe that's how we did it when we did our masters, because ours were essay questions. You needed to do 10 essays for 10 marks. It wasn't MCQs. But over here, it's all about MCQs. So if you're going to prepare in such a way that as you prepared for your previous exams, it's not going to help. So the only right way to prepare is to keep answering MCQs. So the more you do it, the more confidence you'll gain. And it's all a variant of the same MCQ. It's not going to be different. So for example, as I was telling you, the supraorbital fissure, they're going to ask you what comes out through the lateral aspect or the medial aspect. It's the same question that kind of gets, high yield questions, which comes back to you. So the more you answer these questions, the more you're going to remember them. And out of omission, you're going to have 4 options. 2 you'll know for sure it's not the answer, and the remaining 2, it's more out of omission. This could possibly not be the answer, and this would more likely be the answer, and that's how you're going to answer that. Acquire feedback from the previous people who took the exams. They are your best mentors, because that's what I think I lacked initially. So that was a bit difficult, and that's what I used to offer to people who came to me. So I used to give them all the tips and tricks, basic stuff which we feel like it might not make much of a difference, but it will be the sort of the pushing point, that one score that you require to pass the exam might come from someone. So talk to a lot of people who have recently given the exam, like probably the last batch who cleared. So and get their feedback forms. I know it's a bit private, but some people will be willing to give you their feedback forms, which actually gives you a good idea of what is required to pass the exams. And multiple revisions. So I prefer that you would revise 3 times the entire set of question banks that is available to you. If you want 100% chance of passing it, that would make the difference. 2 times is enough. If there is a lack of time, I would say 2 times is enough. But the third time will make sure you're going to clinch that success in terms of the online exams. Could we go to the next slide, Sweta? So what does it entail, the FRC Ophthalmology, in terms of the curriculum? So it is basically basic sciences, optics and refraction. I know people where they have a bit of difficulty is mainly with the biostatistics, the genetics, and the optics and the refraction. So I know biostatistics, sometimes the contribution towards the number of questions in the exam varies, but it is a very important aspect here. We did not have that in our previous exams, in our previous residencies, but now they are giving a lot of weightage. If you see the miscellaneous questions, it can even go up to 40 sometimes, which includes all the biostatistics, the epidemiology, and all that stuff. So make sure that you do have some sort of, idea of where the questions come from. And it's not like you need to know the entire type of statistics. Oh, I need to know all the tests that are there. Not necessary. They still have some high yield questions which keep coming back year after year. And it's the same, from the same question, they structure multiple questions. So make sure you just, if you're able to crack one question, you'll be able to crack the next 5 questions that come after it in the biostatistics. So that's very important. So there are a lot of YouTube videos available for biostatistics. Just go through them and make sure that you go through all the question banks. So these are the sources that we went through personally, and that helped us kind of get through the exams without any difficulty at all. So before, it was in FRCOphth, they had like SBA, single best answers, but that's not the mode anymore. Now we have MCQs, but still the SBA's book is worth a lot, because that's all the high yield questions that they keep bringing back to all the exams. So make sure you go through these set of books, the SBAs, the MCQs for FRCOphth, the FERRIS. I think a lot of people do read FERRIS for the ICO exams. So if you have done that, it's going to help you, because it's got all the basic sciences in them, and they have elaborate explanations for each of the MCQs. So rather than, say, sitting and reading AAO or Kansky for the exam, I would say for the online MCQ exams, read MCQ books, answer MCQs. So that is where the iDocs, the FRCOphth, the OphthQ Bank, they come in. So iDocs is, I think it's a paid website. So they have subscriptions for 3 months and 6 months. I took the 6-month one because I wanted to do for the part 1 and part 2 together, finish it off. It's not too expensive. It's something around 100 to 200 pounds, if I'm right, or 10,000 rupees. So yeah, so they have like a lot of questions with the explanation. I know a lot of people don't like iDocs, especially in the UK, because they feel that the explanation for the answer is lacking. But if you are already finished your ophthalmology and practicing that, then for you, it might be more than enough. But if not, go to FRCOphth. If you're a trainee starting in ophthalmology, FRCOphth will offer you more elaborate explanation for each answer that you're giving. And there's also the OphthQ Bank. And then we have the CHUA's website. CHUA's website also has a lot of MCQs. They have a lot of the pathology slides, the microbiology stuff, the investigations that will come in the exams. And then the optics and refraction. It's very important that you're very comfortable with the optics and refraction, because I know we never practice that in India a lot. I don't even think we did a lot of refraction back home. So coming back to here, you need to know your physics. You need to know your optics. Without that, it's very difficult to pass the first part. So lovely book is the Elkington. Make sure you go from that book page to page. Yes, it matters. You need to go page to page. There is no excuse for that. And then you have the David Hunter video. So he has a 6-hour video on YouTube. Just look at that and I'm pretty sure you're going to pass that. So I'll hand over back to Sweta for the part 2, and I'll come back for the end. Thank you.
So this refraction certificate exam, it can be taken right after part 1 or after giving both the written parts of 1 and 2. It is just that you have to complete this refraction certificate before you sit for the final part, oral and viva. So how does this refraction certificate work? So it was slightly different before the COVID era, and slightly different right after the COVID era. Now, what they are practicing is a hybrid form. So you have to go through various kinds of refraction. So totally there are 5 rooms, and each room has 2 eyes or 2 stations. So you will have a kind of scary looking patient like this. Hiding behind this face would be a model eye where target refraction would have been set for you to find out. You need to refract for objective refraction, which is like non-cycloplegic refraction. So that would be a few stations. and think one station would be a cyclopedic where the patient is dilated. And then you will have about 3 subjective refraction stations where you do, including muscle balancing and Jackson's cross cylinder, which we probably never did during our residency, and one with lensometer. So it is kind of a scary exam in terms of nerves, because you don't have to answer questions, you don't have to talk or show your knowledge. You just have to exhibit your skill in getting the refraction in a particular amount of time. And you have like 10 stations or like 5, I said, and the examiner is just going to look at you. There is absolutely no talking that you're doing. He will just be looking at you, how you insert the trial frame, how you insert the lenses, how you instruct to the patient. You don't instruct for the dummy eyes or the model eyes, but when it is a subjective refraction, the way you instruct, everything carries a mark, and you just have to get the value. So what do we offer you in this? So this is something we can tell you how we went through it. You have something like a model eye. You have to practice with an optometrist, just practicing. Like Shruti rightly said, we might not have done so many retinoscopies in practice over patients. Even if we have, we might have had enough time. So here, the problem is you get 5 minutes per eye, and in 5 minutes, you're expected to write down your glass prescription in an electronic iPad sheet. It's an electronic sheet over the iPad in which you need to enter. So the tips and tricks we offer you is, you need to get this model, how to practice it. You need someone to give you an exam-like scenario where they set the refraction. So if you're going to practice on your own, setting the refraction, you know what you expect. So that doesn't really check your skill time-wise. You have to time yourself to do the math and enter it. Familiarize yourself with the electronic answer sheet. You cannot look at it for the first time in the exam and wonder what this drop-down box is. And lensometer. With the world moving towards autoref and automatic lensometers, to do something manually, to get a glass and find its power on the lensometer, to share my personal experience here, I did not find a lensometer to practice, trust me. So it was difficult. So here the trick is, you have to know that wherever you give the exam, they will make sure that this lensometer is available to the candidates to check the model, where the knobs are. I think it's a couple of hours before the morning session starts. So you can familiarize yourself with the machine. So please be aware of it. This is something that I did not know. And it was very helpful when I spoke to candidates. And you can see that, everybody is kind of on the same boat. And where to find the resources? So this, you usually get instruction to the candidates that are there and how to go about each station. As soon as you register for the exam, they send it over to you. To get an idea of it, we've even given the link to that in our website, which I'll be sharing. What differently can we offer you at Prep Medico is that we can tell you exactly what you need to do. For example, just for an example, if subjective refraction of a sphere, we can tell you what they expect, how it is scored. This is something we did not know ourselves as candidates. So it would really help to know what language to use. Do you change the cylinder? Do you change the sphere first? There are multiple ways in which we can achieve the same result, but the examination expects you to do it in a particular order. So this is something we can tell you how to do, how it is scored, and what exactly to do for you to pass in the first attempt. How accurate do you have to be? If you actually look at the exam reports, looking at the top thing, you see if 100 candidates gave and the Hofstee pass mark was just 103 out of 150. Looking at this, you will feel this is achievable. 68.7% is something achievable, again, with the right amount of practice. And if you see how the candidates across have scored, you'll see maximum lie on the other side of the midline of pass. If this red dotted line is where the pass mark is, see, the majority of the candidates passed. So this is a doable exam. This is something that was not told to us. We had to research and find out, where you need to lie, because that gives you so much of anxiety when your skills are being tested. But honestly speaking, if you practice, it is easy to pass. Part
Sorry,
2.
I'll just add 2 points for the refraction. Is that okay?
Yeah. Please, please.
I think you were telling that the order in which we could take the exams, refraction can also be taken first, even without the part 1.
Okay. Yes.
So we can actually take that. So if someone's really well versed with refraction, you can just go ahead and finish off that exam. And the second thing is, so I practiced by myself. So I actually came to UK to find out resources for the exam for refraction, because no one was doing it in India. So at that point, so the lensometer part, the 4C meter part. So as you were telling, no one has seen it. I've never seen it in my life before. I've seen it in videos on YouTube. So I saw some YouTube videos, and directly in the exam center, they had the 4C meter outside. So you can sit and practice on it for however long you want. Everyone will be doing it right there. So they will have sample glasses with them to sort of test it out. So the main thing I would say with that is people will be very stressed about identifying the prism in the glasses, which is just 1 mark. Trust me, you don't need that 1 mark. So don't even be worried about it. It's one of the easiest exam refractions. All right.
Yeah, that is so true, because when I was so stressed, I remember this part of advice, and I directly went on to just not enter the prism and submit my answer. And I
Yeah,
still
don't even be bothered, because you'll waste a lot of time thinking of trying to get the prism, and you'll not do the other part of the station, which is right? Yeah. Sorry, go ahead.
Yeah, that is something where we can give you, from our feedback sheets, from various candidate feedback sheets, we can tell you what carries mark and what you need to exactly do to just pass the exam, because how much you score really doesn't matter. And coming to part 2 return, the do's and don'ts would be exactly the same as Shruti had highlighted for part 1. It's about how you give it. So it's going to be exactly like that. 2 papers, 90 MCQs, 2 hours per paper, online proctored, where you just set up a camera for the examiner to look at you, your front camera on, so the screen recording is on, and they just see what you're doing. Here again, the technique is mastering a particular topic. The MCQs as such will not be repeated, but the concepts and areas of interest will remain the same across the years. If you just look at the past 10 years and they've asked about retinal detachment, that retinal detachment topic is going to repeat every year. It's just how deep you know about the topic and how in particular related to the UK you know the topic. And you also need to give your weightage depending on the distribution of marks. Unfortunately, even for part 2, you have to revise your basic sciences, and about 10 questions on an average, they turn up from basic sciences, which includes optics, genetics, and this miscellaneous. We just cannot escape this miscellaneous, except it would be slightly tweaked to know about the clinical aspect, especially the ethics and driving, because the medical ethics and the driving rules are given so much importance in the UK compared to other countries, especially compared to India, because almost 90% of the population drive here, and driving is considered a sign of independence in the UK. So you need to know each disease in the eye, how does it relate to driving? How much of glaucoma can one have if they have to drive? How much diabetic retinopathy can they have? How much cataract can they have? How much macular degeneration can they have? So I think there are about 10 to 12 diseases that you need to know in relation to driving with the type of vehicle they drive as well. This is something that will drive you crazy as well, but you need to definitely know. Sometimes the paper, in this example that I've shown, it shows 4, but sometimes there are up to 8 questions that can appear from that. So these are areas which we can tell you, and when you practice the right way, it gives you the push to pass, and it makes a difference in the median score. Again, how difficult is the exam? If you actually look at the pass mark and the pass rate, it looks achievable. There are some dubious years in between, where dubious papers where the pass rate drops to 40-45%, but on an average, they do quite well and you can pass it. And you can see the difference that people here trained in the UK, OST is the ophthalmic specialist trainee who go through this OST pathway, they have almost a 90% pass rate, which means it is totally related to the clinical practice in the UK. So this is where we can give you some insights when you prepare for this exam. And the sources, again, like part 1, iDocs has a subscription, OphthQ has a subscription. Personally, I felt OphthQ was very much related and updated compared to iDocs, because iDocs wasn't updated past 2013 or 14, if I'm not right, but it is not, if I'm right, but it is not a bad source. It again gives you the basic structure. You just need to build your knowledge on the topics that is given. The Oxford Specialty Training Handbook, this was excellent in terms of the standard of questions made and the explanation given. Because if you do one question, it was equal to doing 20 in this book, because the explanation was in detail and how much you need to know with sources. Each answer had the source. And so if you just read that source, you were able to generate about another 10 questions. Kansky to get your concepts right. Unless you know the theory, you cannot do the MCQs. But if you're a practicing ophthalmologist or you're in your residency, you will be seeing these cases day in and day out. So these questions or these MCQs will only build in for you, and it will be very easy for you to crack this exam. Over to Shruti now to tell you about the toughest part. Toughest or easiest will come to you in the end.
Thank you, Shweta. But I think, yeah, this was the toughest part, because in truth to be told, even after finishing the exams, come practice here, it was very difficult, because the way they approached the diseases and the treatment was completely different from how we used to do it back home. So for that, the main thing you would need to do is find a study partner. You do not have a excuse for that. You need a study partner who has experience in UK. So yeah, that's the only way we go about it. Let's go to the next slide, Sweta. Thank you. So it's of two parts. It's a 2-day exam, unfortunately. So you will have a lot of lack of sleep and trust me, so many stress going on over there. So it's Viva and OSCE. So you have 2 separate sessions. So we have the Viva part and the OSCE part. So Viva will entail 5 stations. Next slide, please, Sweta. Yeah. I think I'm going to, yeah, structured Viva. So it will be 5 stations there. So there will be a single examiner in front of you. What you need to know about these examiners is they will have a poker face. So you don't know what they're thinking. You don't know if you're saying the right answer or the wrong answer. It's I remember when I did my MS, at least they used to prompt you, okay, you're going in the right direction, go on, give us more points. Nothing. They will just sit there. They will not ask you. They will not tell you you're doing the right thing or the wrong thing. So don't get intimidated. Just keep talking, giving an answer. So that's what you need to know. So we have 5 stations. The first one would be investigations and interpreting that, and from there they will take the questions, and then there will be 2 patient management. Again, it's just going to be some tricky scenario. So what will you do in this condition? It will just, they have a set of questions, they're going to stick to that. There is no improvising in there. Then we have the attitude, ethics, and responsibility, which we never had in our practices before. It looks like, it's something very vague. It is vague, but if you know a set of, how do we say, like if you have a template to answer one question in that, you can answer all the questions, no matter what they ask you. And then the audit, research, and evidence. Yes, so we do read about the clinical trials for exams. So it's nothing, you need to know about the diabetic trials, the AMD trials, all the important stuff, the GCA. So if you know all the landmark studies, you can get through that. So nothing to worry about. The only thing is, in the Viva station, we're going to have the communication skills. The marks is going to go for the OSCE. It's going to compile with the OSCE, but for logistic reasons, they're going to conduct the communication skills in the Viva station. That is, I felt, was one of the most intimidating parts of the entire Viva exams, because there's going to be a trained actor sitting there. And fortunately for me, they did not cry, but I have heard in situations where they will actually cry. And so they're going to see what you're going to do in that situation. If they cry and you freeze, that's when we fail. So you need to know, be like, oh, it's all right, I'm going to get you a cup of water, all that stuff, which I know we don't really think about it. So it is very intimidating, but all you need to know is they are a trained actor. You're not doing anything wrong. And make sure that it's more of empathetic communication rather than a clinical communication. And you're going to be all right with it. Can we go to the next slide? So we have the OSCE. OSCE is, again, OSCE is very easy. It's all clinical data, which we all know. We are all thorough with it. The only thing, again, as you need to remember is keep answering. It might look very vague. The presentation, the scenarios might look very vague, but they don't care about your diagnosis. They really don't care about the diagnosis. It carries very less marks. As long as you're able to be a safe doctor, in the sense, could be a query diplopia. What are you going to do? I'm just going to send to a CT. I'm going to get the bloods done. I'm going to ask, you don't need to even do it. I will ask the GP to do all these stuff for the patient. So make sure the patient stays alive. So as long as you're safeguarding the patient's life, they are happy with your answers. So don't bother about the diagnosis. So it's very simple. You have anterior segment, which could be anything from cornea, lids, and all that. It could overlap. Sometimes different stations, the cases can overlap a bit, so don't worry about it. So we have glaucoma lids, we have the posterior segment, it could be uveitis, retina. And then we have the strabismus in orbit, which is one of the, personally, I don't really like that one. Strabismus, trust me, you more often than not, you won't be able to get what's happening in the patients. And then the neuro-ophthalmology, that's like, it's very simple. So I had to take the exam twice to kind of clear it, because the first time I went for it, I had no idea what I'm doing there. So I needed to sort of compile what's happening, what they're expecting from us. And they give you a very elaborate feedback. So the examiners, as they note down the points, what you said, what they expected you to say, they will give it to you as a PDF once you're done with the the results and everything. So that gives you an idea of what to do. So for OSCE, you're going to have 2 examiners. So 2 people are going to be sitting there. And they will see, the main thing is they want you to finish off the entire set of questions, because they know for a fact, even though you don't know the first question, you might know the answer for the last question. So make sure you finish off within the time given to you, all the questions that they have with them. Next slide, please. One advantage, what I realized, was we do not have 3 patients. It used to be 3 patients per station, but now it's just 1 patient and 2 videos. So for a fact, examining a patient takes a lot of time, because it depends on multiple factors. In the sense, patient can be cooperative. Sometimes they get tired over as the day goes by. They get tired and they might not be very receptive to your examination and be very helpful in that term. So just having that 1 patient to examine and 2 videos made a lot of difference. So it's becoming a hybrid exam now. And even the FRC Ophthalmology finds it much more easier rather than getting a lot of patients in. But neuro-ophthalmology, it's all patients, because they want you to check the pupils. They want you to do a confrontation fields test. They want you to check the disc. So it's one thing is, if you know what are the common conditions that we as general ophthalmologists face in the clinic, that's all that's going to keep coming to you for the exams. So once that's done, OSCE is very easy to pass. Next slide, please. So coming to the sources, yes, try to get all the clinical trials, the landmark trials, very importantly, and the most recent ones. If you know the aim and the conclusion of the study, that's more than enough. There will be some curveballs. Trust me, if it's difficult for you, it would be difficult for 90% of the people there. So that in that way, it's not going to affect you much. And then one book that I felt was helped me to sort of start off the preparation was the Viva OSCE for the exams. So that book, it's a very small book, but use it as like a notes. So based on that, extrapolate and start reading the other stuff that would be required. Clinically, yes, Kansky was more than enough, and the Oxford handbook was also very helpful. Like Oxford handbook gives you an idea of what questions they will expect here in the UK. So that way it will be useful for you. The next thing, so one we were discussing about the attitude, ethics, and responsibilities. Read the Good Medical Practice. Trust me, it has a lot of points which is repetition. So if just create a template, in the sense, like I would discuss with my line manager, I would discuss with my clinical lead. More often than not, that is what they want you to do in a difficult situation where ethics or all that stuff is involved. Sometimes clinical governance, so patient data is unfortunately left out for people to see. So what are you going to do? Immediately I will discuss with my colleagues, I will talk to the managers, so that's all they expect you to know. Are you willing to ask for help? So these tips and tricks, trust me, if you know what to answer in these questions when they ask you, you'll be given a good mark and a good pass. They want you to be a safe doctor. They don't want you to know everything about ophthalmology. Just, are you safe enough? And if you don't know something, are you willing to ask for help? That's the main question. Next source, please. RCOphth website has their own standards and guidelines. So always when we're answering Viva and OSCE questions, you need to go in terms of as per protocol, as per guidance, as per my trust policy. So you need to know what are the standard and guidances, at least for the basic stuff. What are we getting? Vein occlusions, diabetic retinopathy, AMDs, and main stuff. These are most of the main glaucoma. So if you know how to get the protocol sorted out for those, then that just read to the standards and guidances, and it's not big articles, trust me. They are simple stuff. They have the flow charts. Just go through the flow charts. That's more than enough to get you started. Next slide, please. Also the NICE guidelines. So they will ask you, as per NICE guidelines, what is the management for this patient? So when you also answer that way, as per NICE guidelines, it gives you an extra edge. So they know you know the stuff, because here, when you're offering treatment or denying treatment, you need to give them a reason. What is the reason? As per NICE guidelines, as per FRCOphth guidelines. So only when you say that, it's valid. Otherwise, it won't make sense. Next slide, please. So same thing, almost the do's and don'ts is like same, adequate time. I think if you're not practicing in the UK, you would need a bit of extra time to prepare for this, because I know we're all working and you're taking these exams in between your work schedule and your preparations as well. So maybe 4 or 5 months, it's all right. Take the extra time to sort of, make sure you're very confident. Then multiple revisions is very important. Group sessions help me a lot. So over the weekends, what I used to do was sort of get in Telegram in touch with people who are taking the exams as well. And we used to have mock sessions as a group. So it was a combination of people working in the UK, Egypt, India, Singapore. So it was a lot of people offering. And then we were able to kind of get most of the portions covered and taking mock exams. So I took like almost 2 to 3 mock exams with people who are conducting courses in the UK. And that was timed. It was exactly like how it was in the exam, a complete set of Viva questions and a complete set of OSCE scenarios. So the entire 3 hours, it was a proper examination over the Zoom meeting. And once that's done, they offer you a proper feedback as well. What you did well, what you could have done better, and where you need to read or learn these stuff from. Next thing was avoid arguing with the examiner. So if you that's the thing, they have a poker face. So sometimes we get a bit defensive. We think we're giving a right answer, but we're not receiving anything from them, no acknowledgement. And then we might start going into if you're not really comfortable, or you feel like that things are not going anywhere, we might become a bit argumentative with the answer, because we'll be like, why aren't you acknowledging the answer? We can't do that. So they also look for bedside etiquette. It's very important that you acknowledge the patient, sort of introduce yourself. We can't wash our hands there. They won't have any taps or anything. So at least put the alcohol scrub on your hand, because they do think that. Thank your patient once you're done with the examination. All that carries mark. The moment you leave the station, they're going to ask the patient, are you satisfied with the doctor's care for you? They don't care whether you got the diagnosis right or not, but as long as you made them comfortable, they will actually be more than happy. Trust me, because even over in the practice here, more often than not, complaints happen for the lack of etiquette rather than wrong diagnosis. Even if you get the wrong diagnosis, wrong treatment, if you explain to the patient, you tell them what's happened, they are happy. But if that doesn't happen, then that's when the complaint comes in the incident reports and everything gets filed. So bedside etiquette is very important. Be confident. The first time I took the exam, I realized that I wasn't able to answer a lot, because I wasn't confident with my answers. In the sense, I know the subject, but I did not give the points out, because I was waiting for some confirmation from them, like, go forward, give me the answer. No, they will not do that. So just be confident, formulate a plan, and keep going ahead with the answers. And once you're done, just let them know you're done, so that they can go for the next question. Be very descriptive with your findings. So say it's a pseudophakic patient, you might just look, it's just pseudophakia, pupils dilated, and I see a pseudophakia. What am I telling here? It could be a 3-piece lens. That's what they're looking for. Be very descriptive. It could be a small band, like calcium deposit near the limbus. That's all. You might think it's not a very important finding, but start from A to Z. Just tell them all the findings that you want to say. And as I was telling, communication skill, it does throw you off, but don't be much bothered with it. Main thing with communication skill is trying to find the diagnosis. They won't give you the diagnosis. They just give you a clinical scenario with the vision, potential history. So from that, you will actually have to sit with the patient and tell this is your diagnosis, which is not there in your history sheet. So that will be the tricky bit. Once you're done with that, you will know what to do. Is it about telling the patient not to drive? Is it about registering the patient for certificate of vision impairment? It's very important. That will also be a part of your Viva aspect in the certificate of vision impairment. So beyond what vision are we giving them the resources? Because they don't have caretakers here. They all live on their own. They're very independent. They drive even up to the age of 100. Trust me, they're still driving. So that's why the communication skill is very, very important. Next slide, please. So is it the easiest or the most difficult? It looks easy.
Yeah, it does. When you actually look at the values, when you look at the marks required to pass, it looks the easiest. You feel this is basically to tell you, to boost the confidence to those who appear in the Viva, to look at the graph and see how lesser amount of people have actually failed compared to the number of people who have passed. This is going to give you, look at it every other time when you're going through a difficult preparation phase. This is something that helped me during my own preparation. That's the reason for putting out this slide. But like Shruti rightly said, it is the most difficult exam because you need to be very thorough in your preparation. Once you've done that bit of being thorough, having a template, then the actual exam becomes easy. But stress-wise, the amount of preparation required and the depth of your knowledge for this exam, it'll be the difficult one. So I know it's an oxymoron and I'm confusing you, but I've put it graphically for you to understand the importance of this.
I think the depth of knowledge, we already have that. It's just that letting those people know that we have the knowledge. That's it.
Yes. It's more like an act where you have to display what you know. It's not like our Indian way of the examiner prompting you or asking you. There's no trick. They will not trick you. It's straightforward. It's just you need to speak. Shruti, I just had one thing to differ. Initially, we said the OSCE station had one patient in 2 videos. Unfortunately, now they are changing it because in my entire exam, I had only 3 videos. I had 3 patients for almost every other station. I had 1 video in anterior segment, 1 video in orbit, and 1 video in posterior segment. Others, everything were patients. But it entirely depends on which session you're doing as well. If you're in the final session of the exam and the patients are not willing to stay back, they might be filmed during the first session and kept. The same patient might be kept as a video, but they are trying to move towards patients in order to rightfully examine your skill of examination technique.
Okay, so I think they still there is still a bit of
yeah, it's not uniform. That is what I'm trying to tell.
Okay.
Sometimes they do it 3 patients. Sometimes it's all 3 videos. So depending on the session, it was a bit of a mess. So don't rely on this. This is from the website. This is what as what Shruti has displayed and told you is exactly from the website and the guidance. But practically speaking, sometimes they just change it.
I think, but still, they do take your feedback in the end of the exams. So if an overall feedback of difficulty is expressed to the chief examiner, they take that into criteria when they're scoring you. So I think that helps as well. If it's too confusing and a lot of things going on, it matters. Yeah,
that is very true. Because, for example, I think I'll tell you in the end. I think Shruti still has
almost done. So yes, phrases to use, as I was telling, use the terms as per guidelines, as per our local trust protocol. And you need to be in active phrase whenever you're giving the answer. You can't say that it should be done for the patient. CT should be done. Who's going to do it? You need to be more like, I will order a CT. I will ask the GP. I will refer them to my colleague in the oculoplasty department. And be more than happy to say, I don't know. Just be done with it. Because if you're going to go give an answer which is completely different, you don't know the answer, and then you're just like trying to make something up, that makes you an unsafe doctor. So but saying I don't know makes you a really safe doctor, and then they'll just go on to the next question. That way you will still get marks for the question that you answer, saying I don't know it does not reduce any mark for you. That's it. Next slide, please. So I think the protocol here is listen to the question, take a second, sort of to, you know, what are they asking me from what I have seen, how do I need to formulate the answer, and then structure an answer in your mind before you give it out. Because as I was telling, if you lose your train of thought, or if you're you know, you start off trail away towards the end and you lose your confidence, that's when they find out that you're lacking somewhere, and you yourself will become a bit more apprehensive about giving more answers out. So formulate, structure your answer, and then finally give your answer. Be confident, and once you're done, just say you're done with the answer so that they can go for the next question, because they're still waiting for you to, thinking that you have something to give more. If not, just go to the next answer, because time runs out very quickly here. All right, I think that's it, Shweta, if you can.
Yeah, so like I was saying, what we can offer you on this platform is what helped Shruti and me practice. Like, this communication skills station is something we have never done in our life. Answering ophthalmology we can do, but again, I'll just give you a short example so you can understand that station better. You will be given a chart that says a mother who's pregnant has brought her 1-year-old child, and scans were done. You have seen the scan with a cholesterol appearance, or say a calcific mass was seen on the ultrasound. Please go counsel the mother. So in your head, you have to make up that this is retinoblastoma, that lady is pregnant. So I have to go tell the diagnosis. I have to say the older child has cancer now, might lose the vision, or life if it is in both eyes. So I need to tell that, and I need to say she's pregnant, so I need to counsel her to do the genetic testing. So all this thought process, you will be given 5 minutes, and then you have to go tell the mother. See, so in order to do that, you need to know what all are the practices in the UK. So they have something like a cancer pathway in the UK, and you can, like in India, you cannot just say, you know, bring your husband, bring your relatives for support. No, you have to ask the permission of the mother. Are you okay to get someone else with you? Are you okay? Did you come driving? So you cannot spill a bad news just like that. And you need to know the method here, like how you tell it. You should make them sit. You should have a table between you. You should have a distance. You should offer comfort. And if they are crying, you cannot say, don't cry. There are certain key words that you need to use. You say, you know, let me give you some time to relax. May I offer you a hot beverage? This is like straight out of TV, but then you have to tell that, may I offer you a hot beverage? What can I do to make you feel better? So there are few tricks that you need to actually exhibit. You need to act like you really care. We do really care, but you have to make sure that the examiner can see that, and it cannot appear fake, nor can it appear that you're not empathetic enough. So you need to hit that fine balance. So to do this, you need to practice. You need to practice multiple scenarios. I think for my communication skills, Shruti was the actor. She did about 6 scenarios with me where you need to remember, it's not just the diagnosis, not just convincing the patient, but you should have given out enough info. You should have asked whether they drive. You should convince them that they should not drive if the vision is so poor. You should have spoken about consent. You should have assessed if the patient has capacity to understand what you have done. So there are a lot of things to do in each station. So to organize and have a template, if I get this scenario, I will do 1, 2, 3, 4, 5, 6. So to have that template, we can help you do that. So like I said, we did not have this until one of us had given the exam once and then got the feedback, then sat down, made a template. But here we are here to give you the guidance right there, ready-made for you, what is to be told. And when it comes to Viva, they can ask you anything under the sun. Like I was wondering in my exam, what does Clostridium difficile has to do with ophthalmology? Like I was asked, what will you, how do you treat Clostridium difficile? What are you going to do with the patient? I was wondering, see, you know the antibiotic, but in the UK, you cannot say Clostridium difficile, I will treat with so-and-so, I'm going to give metronidazole. No, you cannot tell that. Here you have a proper guidance. You know the cause for Clostridium difficile. You might be very good. In India, you're allowed to prescribe, but in the UK, you cannot do that. There is a pathway where you go to the GP, you have to involve the infection control board, you have to involve the microbiologist. So the administration part of stuff in the NHS trust is something you need guidance for. So we will be able to give you that. So I think the initial part of the course, like what Dr. Manikandan had told earlier, we're going to be concentrating on the Viva part, being the most difficult / easy one to do. But we will also be offering guidance on the other steps. For this step, we will be able to do one-on-one mentoring. Make sure your way of communicating the answer is right, because all of us have enough knowledge, training. We might be very strong in the subject, but to put it forth for a third person to understand that you know is the trick here. All the info that we have put up in this presentation, the attends, the fee structure, how to go about resources, the link for the resources and study material, and what we have used, we've put up in our website. You can register for the one-on-one mentoring right away. If you need guidance for the refraction certificate exams as well, you can register, and our WhatsApp groups are live. So any doubts you can post. The work culture here is quite difficult. So if we don't get back to you right away, do not mistake us. But as soon as we find time and we're back home, end of the day, we will get back to your queries. Like we said, we have had very few people to guide us in the right way, and we are willing to offer you the right amount of guidance here. Thank you for listening to us. If anybody has any questions, I'm sure there are a lot of questions running through your mind. So please feel free to unmute or raise your hand. We are here to answer the questions. There's no question that is silly. That I can assure you, because I think the number of times I've panicked and called Shruti is like, what sort of a question is this? Why do they ask this? Is this necessary? Do we go and use alcohol rub? What do we do there? So you can ask any type of question in any part that you want. We are here to answer. Honestly, each of us finds a particular type of examination difficult. Like I did not like the MCQ part. I found that the most difficult. I was better with the practical stuff. Some of us are different. MCQs are easier. The practical stuff is difficult. So any questions, please just ask us. Or you can just type it out in the chat box as well.
I think mostly they will start having more doubts once they start preparing for the exams.
Yeah, that is also that. And step 1 to exam is not be shy. So is passing FRCS going to help any of the steps of FRCOphth? That's a very good question. FRCS Glasgow might help you get the General Medical Council registration, but it is not in any way connected to FRCOphth. You have to repeat from step 1 to step 4. Even if you've given FICO, you have to do step 1 to step 4. Even if you have an MRCOphth that is valid previously, you have to give FRCOphth from the beginning. There are consultants in the UK who have become consultants with MRCOphth, but to proceed further, to get a permanent post, they have to give FRCOphth from step 1. Unfortunately, that has been the norm now because of, I think, clashes between various royal colleges, and finally they've made a uniform standard for ophthalmology.
But I think if you have given FICO, you can directly take FRCS third
Glasgow.
part.
Yes.
Yes.
The third part of FRCS Glasgow. Yes.
But I would still say it's a stepping stone in the sense, if you're already eligible for FRCS third part or have the Glasgow degree, take that, get into UK, and then give the FRC off. Don't wait to finish the FRC off.
Yes, yes. To enter into the UK, that is enough. Like I said, you can get the General Medical Council registration with that. So that is there. I think I know most of you in this group, so just don't be shy. If you're giving the exams and you want to ask anything, just please do ask. Thank you, Pragya. Nice seeing you here. either we were very clear or we were very fast. But
no, I think honestly, Sweta, I think it would be once they start preparing, that's when the doubts start popping up.
yes,
It
so
would be-
you're free to message on the WhatsApp group, and the idea or the aim of this WhatsApp group is to be able to meet fellow people preparing to form study groups. Because to form a study group, I think I struggled so much to find people who will be willing to study with you online, to meet every day. Because I had 2 friends from Pakistan and 1 friend from Egypt preparing with me. So we had to align the time zones, and then we had to invite Shruti to come monitor us. So that's where this idea came from. We will be able to offer you that. Even if you're doing a study group session, we could just pop in for half an hour and, fine tune. This is not how you answer, this is how you do it. So that's something you need before the exam. We will be able to offer you that. And that's the idea of the WhatsApp group, to meet other people, to know if someone else is giving the same step as you are giving. To get that study buddy is something that we all struggled with, and that's the idea. So,
and something off track over here. So if people are, I know the exams can be taken just for the degree, if you're moving to UK to become a consultant. So if you're moving to UK, then I would suggest start the journey right now in the sense of the portfolio pathway. Start a logbook. I think that's as simple as it could go. See what number of cases needs to be done, like assisted, observed, and maybe start keeping a logbook, because there was, I think, the number of steps that is involved in becoming a consultant, it seems very daunting. But if it's done in a systematic and a structured manner, it's quite a simple process. So do it all side by side and just get it sorted out. Yeah.
Okay, thank you everybody for joining us on a Sunday.
Yeah.
I hope we've cleared some doubts that are there lurking around. And if there's more, please reach out to us on the group. And we thank Prep Medico and Dr. Manikandan for this opportunity. Thanks, Shruti.
Thank you, sir. Thank you so much.
Okay, guys. I think we'll stop the session now.